Today's conversation is about the challenge of climbing the corporate ladder as a Black male. While Black employees are making strides in entry level positions, only 7% of mid management roles are held by Black professionals. According to Fortune, only 3.2% of Blacks hold executive positions and are paid 13% less than their white counterparts. While diversity is vital in all industries, diversity in healthcare leadership matters because healthcare disparities are important to solving for health equity. For one, Black healthcare leaders greatly affect how their healthcare organizations and systems function and how they develop new policies for future generations. The Agency for Healthcare Research and Quality published a disparities report that showed that African American patients received less quality care than their white counterparts for 41% of quality measures. So now I'd like to introduce you to today's guest, Tosan Boyo. Tosan currently serves as the Senior Vice President of Hospital Operations at John Muir Health and oversees operations at John Muir Health Walnut Creek Medical Center, Concord Medical Center, and Behavioral Health Center. Tosan also currently serves on the board of directors of the Institute for Healthcare Improvement. He previously served as the Chief Operating Officer of Zuckerberg San Francisco General, and while there, he founded the ZSFG, Zuckerberg San Francisco General Equity Council, and his development of the enterprise-wide strategy to advance equity actually received the Best Initiative Award from the Disparity Solution Center. In February of 2020, he was appointed to the San Francisco Director, he was appointed by the San Francisco Director of Public Health to serve as the Deputy Commander of the city's COVID-19 Operations Center. During the height of the pandemic, in one of the most densely populated cities in the U.S., San Francisco actually achieved the lowest death rates, case rates, and highest testing rates. Tosan, welcome to Chats with the Chief.
Thank you for having me, Duane. Happy to be here.
We are happy to have you. So let's jump right in. Can you tell me a little bit about your journey to becoming an SVP of hospital operations at John Muir?
It all started, well, first I would say that I did not get to where I am by myself. I truly believe in standing on the shoulders of others who have mentored me and supported me. And healthcare has always been a calling for me. I am a child of health workers. My father is a family practice physician in Nigeria, and my mother is a clinical lab scientist in New Jersey. And what's been really fascinating for me has been how powerful, when you grow up in a family of healthcare, you learn from a very early age that it's a calling and that it's sacred. My career started out in psychiatric hospitals. I started out as a mental health counselor in New Jersey at a psychiatric hospital, and after that, I really got into performance improvement work and operations. And it's been a journey for me to truly understand what does it take to put patients at the center. What does it take to ensure that you're listening to the voices of the front line? And then I had the privilege to be recruited to UC San Diego to do my administrative fellowship. And it was based in ambulatory operations. And about 6 months into my role at UC San Diego, I was given the opportunity to become a clinic manager. And, since then, I've always developed a passion for problem solving and truly trying to understand what does it take to address the needs of those with great vulnerabilities and the communities that are struggling, and how do we come up with solutions that are going to be sustainable over time. And again, based on having great mentors and standing on the shoulders of others, I've cultivated a reputation for really trying to solve problems in the long term, and that's really created opportunities for me. And then after San Diego, I was recruited to Alameda Health System, where I worked at Highland, which is the safety net hospital in Oakland, leading their primary care clinics. And then from there, one problem solving led to another. And again, with the philosophy of putting patients at the center. And then I went to San Mateo Medical Center, where I was the director of ambulatory services, leading the clinics in the county. And I would say one overlying theme that comes to mind for me has been I've remained very passionate about supporting and taking care of those who have the least. And when I think about the philosophy of health equity, those who have the least, those who are most deprived, those who are the most disenfranchised, those who are the most vulnerable, the communities that are struggling on the most fundamental levels, I believe by providing the most attention to these communities, to people who are vulnerable, we end up providing the best care and advancing equity and ensuring that no one is left behind. And that's been a fundamental principle for me through my career. And I have the privilege to be serving at John Muir Health right now.
Excellent. That's a wonderful story, and certainly appreciate uh, really bidding from those who have come before us and sort of paved the way, particularly for African Americans in the healthcare field. So, what advice would you give to others who are interested in following in your footsteps?
Hmm. That's a good question. Uh, well, the first thing I would say is ask yourself what gives you life. What is your why? What is your mission in healthcare going to be? What are you trying to solve? What are you trying to change? And by doing those internal assessments and asking yourselves those questions, I believe that you get an understanding of what your role is going to be. So that's the first thing I would say. The second thing I would say is be authentic. And by be authentic, I mean be true to yourself. Find ways to bring your whole self to work. And by bringing your whole self to work, I mean understand what your story is, embrace what your story is, and think about how is you being in this role that you're trying to take on, how are you going to make an impact and how are you going to make a difference. And to me, that's the power of authenticity. Bring your story with you to work and focus on how you want to make a difference every single day. And then the third thing I would say is always do deep analysis in what is the problem you're trying to solve, especially when you come into healthcare. It's inherently dysfunctional, it can be inherently chaotic, but it doesn't have to be that way. What separates our industry from others is at the end of the day, our priority is how are we supporting those in need? People come to hospitals and clinics when they're at their most afraid, when they're vulnerable, when they are in pain. And I believe it's a sacred trust in health workers to be there for those people. So I would say make sure you are tied to the mission of the organization you want to be a part of. And then the last thing I would say is volunteer for projects, volunteer to solve problems. And by doing that, people will know that it's not about you, and you want to know how you can contribute, and you want to know how you can make a difference.
Thank you. I really resonate with the concept of understanding your why and bringing your whole self to work. I really think when we are at our best, we have discovered who we are and what our purpose is, and we lean into that purpose. And really, you become your best self, right? No one can be as good as you are at being yourself, and that is our power.
Yeah.
So, my next question for you is what challenges did you encounter as a Black male moving up the ranks in healthcare leadership?
Mm. You're gonna go straight there, Duane. Well, I will say that. Um, well, and I'm gonna speak for myself, and I'm not going to assume that this is the experience of other Black men in
Mhm.
leadership. For me, I believe that whatever room I'm in, I'm an ambassador, whether I like it or not. I was born and raised in Nigeria, so I'm representing, 2 billion people on the African continent, and then I'm representing 11% of the US population in every room that I'm in. And I am okay with that. Matter of fact, I embrace it. And for me, that means that I have a responsibility to to represent effectively. I have a responsibility to be effective in the solutions I am working on. I have a responsibility to be effective in the problems that we are trying to address. And I have a responsibility to ensure that the most vulnerable always have a voice at the table in the rooms that I'm in. I have a responsibility to ensure that um, no person or community is left behind. So for me, those responsibilities are not burdens; they are duties, and I embrace it wholeheartedly. And but when you talk about challenges, I think they're just certain things that you come to expect when you are a man of color, when you are a black man in a leadership role. More often than not, you might be the only one in the room, and more often than not, you might be one of the first in the rooms. And those challenges, I do not dismiss at all. I take it, I own it, and it's a duty and responsibility to me. But that also means that I have to ensure that I might be the first one, but I should not, and I should not be the last one. And for me, that also means constantly looking for ways to open doors and mentor others that can follow in the footsteps that I've been following, and then follow in the footsteps that I'm leaving.
For representation, for mentoring. But I'll also acknowledge that that is a heavy weight
Mhm.
to carry. Um, and I'm saying this so that the audience understands that um, as minorities in different demographics, you often carry that weight of being the only or the first, of having to mentor a lot of people who are wanting to, ascend in the organization,
Mhm.
thinking about the community. It is both a weight but a true privilege,
Yeah.
and that to me is part of the difference and need for people who are part of diverse communities to be in leadership, because we bring that lived experience
Yeah.
to the table, and we bring those values that you spoke of.
Yeah.
So,
And I would say, I appreciate your description of weight, and I would clarify that for me, again, speaking for myself, the difference between weight and burden.
yes.
I'm an avid backpacker. I love going to the wilderness and traveling and camping and things like that. And for me, when I think about that weight, it's like going backpacking. You have your sleeping bag, you have your supplies, you have your purifying tablets for the water you're going to drink, you have your raincoat, you have your hiking boots, and all that stuff in your backpack to make it through the trip, to not just survive but also to thrive. And I think that when you are the first, when you're one of the few, and when you're a trailblazer as a person of color, there is sometimes a switch that some people can make, in some cases have to make, from looking at the weight as a burden, and really more as to your what you just said, as a privilege. And the question becomes, what are you going, are you going to view the weight as a burden, or is it going to be your backpack?
Yeah.
Is it going to be how you thrive and blaze a trail for others? And is it going to be how you inspire? Is it going to be how you educate? And for me,
Mhm.
I choose to view that weight as a privilege, and really my backpack.
Mhm. I appreciate that. It really becomes the strength that we
Yeah,
bring to the table in organizations. Yeah.
yeah,
And it's about learning how to carry that weight,
mhm.
uh, but also take care of yourself in the process.
Absolutely. And you highlight a very powerful point, and I think that's one of the main flaws that I would say many leaders, especially trailblazing leaders, take for granted, and that is self care. And for me,
Mhm.
that's something I've had to learn the hard way, in the past 18
I've
months
been there.
during the pandemic and now.
Well, I want to remind the audience really quick, if you have any questions, go ahead and put them in the chat and we will certainly get to answering some of those. My next question for you is, what would you say to someone when they ask why diversity, equity, and inclusion are important in health and healthcare?
Good question. I would say that without utilizing an equity lens, I don't I don't believe you can know that you are having the same, if not more, impact for everyone, right? So, for example, we know that African American women have I think it's about 243% more likely to experience morbidity and mortalities during birth, and that's a fact. It's not a debate. So an equity lens is how you ensure that you are not perpetuating that statistic in your organization. An equity lens is how you ensure that someone who English doesn't happen to be their first language has just as much access care as someone who speaks English fluently. An equity lens is how you ensure that someone who has issues and challenges with eyesight can navigate your hospital campus as someone who has perfectly 20/20 eyesight. So I don't believe that equity in 2021 can be an option. I think ultimately, when you understand and appreciate that health workers are choosing to come every day to work to ensure that they're taking care of those in need, those in pain, those who are vulnerable, we want to ensure that we're doing that for everyone and no one is being left behind. And an equity lens is how we do that. And that is how we ensure that we're not just talking.
Yeah,
It's how we ensure that we are walking the talk as well.
thanks. I appreciate that perspective. And in thinking about that, how do you feel like we can come together within healthcare organizations with community partners to really solve the diversity and health equity gaps that
Mm.
exist in healthcare?
Well, I would say it starts with a couple of things. The first is acknowledging that equity is and should be a strategic priority in your organization. So that's number one. Number two is making sure that your institution, that means your leaders, all the way from the top of the organization to the front line, understand why equity should be a priority. Okay. Number three, when you look at all your quality metrics that are important to the leadership, to the front line, and to patients who come to get care, how are you stratifying the metrics by race, ethnicity, language, sexual orientation, and gender identity? And you need to stratify that data because that is how you're going to determine if there are any disparities or not. That is how you're going to determine that no one is being left behind. That is how you're going to determine that no one is getting worse care solely because of how they present or solely because of what information they don't have when they present. And then when you start stratifying that data, the next step is when you identify gaps, if there are gaps, what are you doing to close those gaps? And in closing those gaps, that's where organizations start understanding what is their role in ensuring that disparities do not continue to be perpetuated in their community and ideally across the US? What is their role in ensuring that systemic racism is not resulting in poor outcomes in the institution and then in the community? What is their role in ensuring that challenges in the community, like redlining, which in many cases results in malnutrition, which in many cases results in socioeconomic despair, doesn't follow patients into the hospital, which in turn results in poor outcomes. So those steps that I've mentioned, from prioritizing equity, ensuring the organization understands why equity should be a priority, stratifying metrics by race, ethnicity, language, sexual orientation, and gender identity, and then establishing hypotheses and closing those gaps, I believe, is how healthcare comes together to solve disparities and also address a lot of the systemic biases across the US.
Thank you. Well, Tosan, it doesn't look like we've had any questions come in, but I want to thank you for your time today. Oh, actually, it looks like we have one. So I'm going to just read this real quick. As a woman who has rapidly climbed the corporate ladder, I was greatly helped along the way by reading Sheryl Sandberg's Lean In book, which teaches women like me to navigate within unfair biases that people have for career women, rather than obviously fight against those biases. The idea is that the world is biased and will only get less biased as diverse people creatively navigate their way to the top. So rather than fight against the system, just navigate it carefully and smartly to make change when you arrive in a position of power. This was a controversial proposal, but has worked well for me. Is there an equivalent book for men and women of color?
Great question. I would say that for me, it has always been about what I mentioned earlier. I don't know that I subscribe to it being a battle. I do believe that navigation is key, but also when you understand your why, when you have a deep clarity of what difference are you trying to make, I think this is where you have to understand what your role is. So books that have worked for me, that might not always be tied directly to DEI. An example of that is The First 90 Days by Michael Watkins. I believe that's like a classic book everyone should read before you start a new job. Another classic one for me is The Phoenix Project, which is about leaders in new organizations. And although those books do not always delineate with an equity lens, I believe that understanding how to navigate culture is a fundamental thing. And then the perspective that you bring to the table should influence how you look at a lot of those reads.
Yeah. And I would agree. It is definitely about navigating, particularly when you're sort of paving the way.
Yeah.
But I also think that we have an obligation to start to deconstruct and reconstruct the system to work for everyone. Right. So we know what the system is now and who leads the systems. And I think it's our opportunity as we step into these roles to think about how we dismantle and make our environments more inclusive. And
100%.
I'll just mention a couple books that I think are good. I read Cracking the Corporate Code, which is about Black executives in corporate America. And Working While Black was another one that I read early on in my career. And it gave me a really good perspective about stepping into the workforce and some of the challenges that I might face.
Uh-huh.
So, Tosan, I know that you have to move on to your next meeting. So I'm going to wrap up here. But I want to thank you so much for your time today. And you can find more about the work Tosan is doing in John Muir Health by visiting johnmuirhealth.com. And thank you to our audience today. If you know a chief we should be chatting with, please nominate them by sending us an email at info@justhealthcollective.com. And also be sure to subscribe to the Just Health Collective newsletter to receive updates about future events and chats. Thank you all so much for joining us today.
Thank you, Duane.
Thank you.